Hey, this is Dr. Ty from Premier Orthodontics, and in this video I'm going to show you before and after of an actual patient that had open bite treatment in our office. We'll show you how the whole process works, why we chose the treatment plan that we did, talk you through the whole process, and hopefully demystify everything. So let's get started. Alright, so let's go ahead and jump in here and show you the patient. You can see this patient, she is in her early 20s. She had wanted braces her whole life and her family couldn't afford it, so when she got into her 20s, she started working, making a little income. So one of her first investments was to get her teeth fixed. She said that she always hated the way they looked and was so excited to get it started. So you can see she has some very crowded teeth, top and bottom. You can see several of her teeth are blocked out of the arch form. You can see the lower second molar, this is a 12-year-old molar. It is blocked out and it can't actually grow in. So even though she's in her 20s, that tooth hasn't fully grown in yet. That's just due to the amount of crowding. So, in certain cases, there's just not enough room for all the teeth to fit. And this is one of those cases. And as well as that, she was biting only on her back teeth. You can see the front teeth, canine to canine. We didn't have any contact on those teeth. And so she always complained that functionally it was very hard to bite into like a piece of lettuce with her front teeth. She couldn't bite into a piece of pizza. She had to use her back teeth exclusively for biting. So cosmetically this doesn't look good, but functionally that makes it very difficult to chew and eat, as well as these back teeth tend to take a lot of wear and tear. Ideally teeth would share all the load of biting, but in cases like this with open bites, these back teeth take a lot more wear and tear than they should, and over time they do tend to wear down. So she's still young in her early 20s, so not a lot of damage has happened, and we can get her fixed and hopefully get her a good, stable bite moving forward. So treatments for open bites, we have a couple options that we might consider. So one is elastics or rubber bands. We'll show you how that works. Another is extractions. Another one is TADS, which stands for temporary anchorage device, or sometimes it's called an orthodontic mini screw. We'll show you what that looks like later on. Another option for open bites is jaw surgery. So jaw surgery for open bites is a good option for certain cases, and it is also an option that's very expensive. So this patient especially, she's in her early 20s, and paying for braces was a little bit of a stretch, and so the option of jaw surgery was not going to be something that was going to be possible for her. So we talked about it. It wasn't something that she was even going to fathom, so we kind of quickly moved on to some of our other options. So elastics for open bites, we'll show you how they work. These are very effective in mild to moderate open bite cases where you have just a little separation from the top and bottom teeth. So teeth have a limit on how much they can move on their own, and it's like 2 to 3 millimeters up or down. And so if you have a 2 to 3 millimeter open bite, rubber bands can help to pull those teeth together, and they can be very helpful, especially in cases of mild overbites. So rubber bands was something that we decided we were going to use in her case, in addition to some of the other options. So these aren't exclusive. You can do one with another to try to help utilize all these options. So again, in her case, she had a very pronounced open bite. It was beyond what rubber bands could fix alone. So we knew we needed to do some things in addition. So extractions can also help with open bite correction. We can show here, in cases of open bite, especially where the front teeth are procline or flare forward, you can take out some bicuspids and using the braces pull the teeth back. And by pulling the teeth back, that tends to pull them down and back and will help to correct that open bite. And if you decide to treat without extractions in this case, you can see, if you can imagine just putting braces on and trying to resolve this crowding, what's going to happen is those teeth have to go somewhere and they're going to flare forward. And when they flare forward, the top ones are going to go up, the bottom ones are going to go down. And that would actually make this open bite even worse by just doing braces without extractions. So in her case, we decided we needed to take out 2 upper bicuspids and lower bicuspids. That's going to help to resolve the crowding. And like I mentioned, when her lower arch especially, those lower second molars couldn't grow in because there just wasn't room. So by taking out some teeth, closing those spaces, that's going to allow that tooth to grow in. And it's going to make it to where we can resolve her crowding without making the open bite worse, but it also will help to close the bite a little bit as well in that process. And then another option that we consider for more of the moderate to severe open bites is called orthodontic mini screws or TADs. So if you were to just do braces, this animation is going to show what that looks like. It straightens the teeth out. And then if we want to close the open bite, we can try to pull the front teeth down with rubber bands like I mentioned, but we can also try to push the back teeth up. And that's where that orthodontic mini screw comes in. So we place these tiny little screws. They're not as bad as they look. We get the area numb. It takes about 10 seconds to place these screws. It's much easier than even getting like a filling done or a cavity fix. It's a very simple process. We do these in our office. But with those screws, we can use some springs and push the back molars up. And as those back molars go up, the lower jaw swings forward and helps to correct that open bite. And once we're done with the screws, we simply take them back out. This is, again, a very simple process. We do these screws in our office routinely. We do them on kids as young as 11 or 12. It's not a big deal. It is something that looks scary, but I promise it's not as big a deal as it sounds. So for our patient, we decided we needed to do a combination of all three of those. She had a pretty severe open bite. So we decided we were going to do some rubber bands in the front to try to get as much extrusion of those teeth as we can. Again, we can expect about 2 millimeters of correction. We were going to extract teeth so we can fix the crowding without making the open bite worse. And that will help to resolve the open bite a little bit by pulling those teeth back. And then we were going to do that mini screw in the roof of her mouth to try to push these back molars up. And that's going to give us 2 to 3 millimeters of correction by pushing the back molars up, 3 millimeters of pulling the front teeth down. By doing a combination of those, we can get quite a bit of open bite correction without having to do any kind of surgery. So this patient, we put braces on. We sent her to get 4 teeth taken out. After about a year of braces, we placed that little mini screw like I showed you. And this is where she finished up. You can see we were able to get full open bite correction. Top teeth are now touching the bottom teeth. This is where she had the 2 bicuspids extracted on the top. Here's where they were extracted on the bottom. You can see once braces are finished, the spaces are entirely closed. You can see that back molar. I know it's a little hard to see in this photo, but that molar that was trapped down that couldn't grow in is now fully in the mouth, and she's now able to chew with it, and it's not stuck under the gums like it was before. You can see she now functionally can chew much better. She can use those front teeth. All the teeth are balancing the load. We were able to get full open bite correction in less than 2 years in her case. So here are some before and afters. You can see how dramatic of change this was. Just from getting the teeth straight, how much that changed her smile. You can see in the smiling photos before, the teeth were really high up and you couldn't see any of the gum line. By doing the rubber bands in the front, it helped to pull those teeth down. Gave her this nice, beautiful smile where you can see all of her teeth, as well as just a little bit of the gums, which is what we like. We were able to get all the teeth to fit into this arch. You can see by having this tooth extracted, this one was able to be brought back and get that bite corrected. She now can chew with her top and bottom teeth as well. And functionally, this works a lot better. Cosmetically, it looks a lot nicer. And this is going to be a lot more stable result than trying to do this, some other method. Here is before and after of the top and bottom. You can see we use permanent retainers in her case. Anytime that these back teeth are this far back, they're going to have a tendency to want to return in that spot. So by putting in this permanent retainer, that's going to be more secure. They're going to stay put. Then we had one on the bottom as well. And you can see by the time we're done, no one's going to be able to tell that any teeth were removed except for me and her dentist. And everything fits together and everything looks beautiful. And there's really no downside to having these teeth taken out. And the major benefit is she gets full bite correction and everything looks perfect. So that was this patient's case. There are lots of ways to fix open bites. Depending on the severity of the bite, there are different treatment options that may be considered. This is how we chose to treat it in our office. So if you have any questions about open bite treatment, feel free to ask them in the comment section below. We'll do our best to answer. If you're new to the channel, make sure to subscribe for more braces related content and tap that bell. If you found this video helpful, please give it a like. It helps our channel grow. And thank you so much for watching. We'll talk to you soon.